The 3M Fit test kits use a qualitative method to check that the wearer can achieve an adequate seal between a tight-fitting facepiece and their face. It relies on the respirator wearer's ability to detect the taste of a solution that is injected into a hood as a fine mist. The kits are suitable for testing maintenance-free particulate respirators and half-face reusable respirators with particulate or combination filters. In addition to understanding the content of this training video, anyone conducting a fit test should meet the criteria for a competent person detailed in the Health and Safety Executive's information document on fit testing, HSE 282/28, freely available on their website www.hse.gov.uk. The box contains a hood and collar, two nebulizers, 2 bottles of solution, spare nozzles, and user instructions. Replacement parts are available if any damage occurs or the solutions run out. 2 versions of the test kit are available. 3M FT10 uses a sweet-tasting solution, and the 3M FT30 uses a bitter solution. The 2 kits allow a choice to be made and provide an alternative if someone is unable to taste one of the test solutions. The complete test breaks down into 2 parts: the sensitivity test and the fit test. Firstly, unscrew the nebulizer labelled Sensitivity Test Solution and pour in approximately 1 teaspoonful of the sensitivity test solution. Pour a similar amount of fit test solution into the second nebulizer. Check the nebulizers are producing a mist. Confirm that the test subject has had nothing to eat or drink except water and has not chewed gum during the 15 minutes before the test. Fit the hood without a respirator fitted and arrange the hood so that there is a gap of approximately 15 centimeters between the front of the hood and the subject's face. Ask the subject to breathe through their mouth with their tongue slightly out and indicate when they taste the solution. Place the sensitivity test nebulizer into the hole in the front of the hood. Squeeze the bulb to inject the test solution. Allow the bulb to inflate fully between squeezes. Count and take a note of the number of squeezes it takes for the wearer to taste the solution. If the wearer tastes the solution between 1 and 10 squeezes, then 10 squeezes of the fit test solution should be used at the start of the fit test. If 11 to 20 are required, then 20 are used, and if 21 to 30 are required, 30 squeezes are used. If the subject has not tasted the solution after 30 squeezes, then the alternative kit should be tried. The sensitivity test is important as it verifies that the solution is suitable for that person and establishes their taste threshold. This in turn governs the concentration and therefore the number of squeezes used during the fit test. Time should be allowed for the taste to clear from the wearer's mouth before starting the fit test. Rinsing with water may speed this up. The subject should also wipe their lips to remove any residual sensitivity solution. After the taste has cleared, ask the subject to fit their respirator and perform a fit check. They should also wear any other personal protective equipment or glasses that will be used with the respirator and might affect its fit. Explain the test and the exercises to be performed. The exercises are designed to simulate some of the stresses the face seal experiences during the working day. 7 exercises should be performed for 1 minute each. The exercises are: breathe normally through the mouth, breathe deeply taking care not to hyperventilate, turn head from side to side in slow, deliberate movements, move head up and down, inhaling when the head is up, read passage of text out loud, bend at the waist as if to touch your toes. Finally, breathe normally through the mouth. Ask the test subject to tell you if they taste the mist at any time. Instruct them to breathe through their mouth with their tongue slightly out. Using the FitTest nebulizer, inject the FitTest solution into the hood. Use the number of squeezes defined by the sensitivity test, i.e. 10, 20 or 30. Ask the subject to breathe normally and start a stopwatch or note the time on the second hand of your watch. There is a tendency for the mist to settle out of the hood. Therefore, you will need to maintain the concentration within the hood. This is achieved by injecting half the number of squeezes you started the test with into the hood every 30 seconds, i.e. 5, 10 or 15 squeezes. After 1 minute, ask the subject to start deep breathing, taking care not to hyperventilate, and again remember to top up the concentration every 30 seconds. After 1 minute of deep breathing, ask the subject to start turning their head from side to side in slow, deliberate movements, pausing slightly to inhale at each extreme. After 1 minute of this exercise, ask the subject to switch to moving their head up and down, inhaling when the head is up. After 1 minute of this exercise, and while still topping up the concentration every 30 seconds, hand the subject the passage of text in the user instruction and ask them to read it out loud. They should reread the passage for a full minute. Alternatively, they may count out loud. After 1 minute, ask the subject to bend at the waist as if to touch their toes. Finally, ask the subject to carry out a minute of normal breathing. Once the subject has performed all of these exercises without tasting the mist, they have passed the test. After a successful pass, you may want to ask the subject to reach up inside the hood and break the respirator seal. By tasting the solution, the subject will gain an appreciation of what the respirator has been protecting them from. This example of respirator effectiveness can be used as part of your training program to illustrate the importance of achieving an effective seal on the face. If at any point during the test they indicated that they can taste the mist, stop the test and remove the hood. After allowing time for the taste to clear from their mouth, repeat the sensitivity test. Have them refit and adjust their respirator and repeat the fit test. 2 failures, where you are confident that there are no obvious fitting errors, may indicate that the model of respirator being tested is unsuitable for that person's face shape, and another size or model should be tried. After the test, a record should be created. Use the 3M record sheet available on this CD or our website, or create your own. Details of the content of a record can also be found in the HSE's information document. The nebulizers should be thoroughly rinsed out after use and wiped dry. If the nebulizer becomes blocked, it can be cleaned with the pin provided, or the jet can be replaced. Fit testing is an important step towards ensuring that the correct levels of protection are achieved from a respirator. It is vital that a fit tester fully understands the test procedure and carefully briefs and monitors the test subject. For more information on fit testing or any of the 3M products, contact your local 3M representative.